long-term care program with the National Alzheimer's and Dementia Resource Center. Sorry.
Thank you so much, Rob, and thank you everyone for joining us today for the National Alzheimer's and Dementia Resource Center webinar, Elder Abuse in People Living with Dementia, Considerations for Prevention, Detection, and Intervention. The National Alzheimer's and Dementia Resource Center webinar series is supported by the Administration for Community Living. Before we start, Erin Long of the Administration for Community Living will provide a brief welcome. Erin?
Thanks, Sari. On behalf of the Administration for Community Living, I want to thank everyone for taking time out of their busy day to join us for this very important webinar. I also want to thank Dr. Laura Mosqueda and Charles Sabatino from, respectively, the National Center on Elder Abuse and the American Bar Association Commission on Law and Aging. We're very fortunate to have experts, subject matter experts of their stature joining us today. So I'll give it back to you, Sari, so we can get right on to business. Thanks again, everyone.
Thank you so much, Erin. As you heard, today's presenters are Dr. Laura Mosqueda and Charlie Sabatino. Laura Mosqueda is a family physician and geriatrician who engages in clinical care, research, and education. She is the director of the National Center on Elder Abuse and the medical director of the Los Angeles Elder Abuse Forensic Center. Her particular areas of interest include primary care for people living with dementia, elder mistreatment, and person-centered care. We also have with us today Charlie Sabatino, who is the director of the American Bar Association's Commission on Law and Aging, where since 1984 he has been responsible for the ABA Commission's policy and practice research and development, as well as education in health and long-term care, guardianship and capacity, surrogate decision-making, end-of-life care, and legal services delivery to older persons. He is a fellow and former president of the National Academy of Elder Law Attorneys and an adjunct professor at Georgetown University Law Center, his alma mater, where he has taught law and aging since 1987. I will turn the presentation over to Laura and Charlie, and we will address questions at the end.
Well, thank you. It's a pleasure to be with all of you. This is Laura Mosqueda talking. And just so you know the game plan, I'll be talking for about 20 minutes, and then Charlie Sabatino for about 20, so that we really want to leave time for engagement to the very best of our ability on this webcast. Special thanks to the National Alzheimer's and Dementia Resource Center, which just does a terrific job and has great resources, certainly that I use, and a big thanks also to the ACL for getting this organized and recognizing its importance. It's a particular pleasure for me to be presenting with a friend and colleague, somebody I admire a lot, Charlie Sabatino. So I just appreciate this opportunity. If we look at my first slide, I can't tell if it's up. Can somebody just let me know if my first slide, there we go. Thank you very much. Just to get it out of the way, I do get called Dr. Mosquito a lot. Let's move on to the next slide and dig right into this very important topic. Let me manage this here. This very important topic. People who live with dementing illnesses may not even recognize that they're being abused. I just actually this morning was reviewing a case like that. A man very severely impaired who was getting hit by a paid caregiver, and he didn't even know what was going on. The family discovered this with a video camera. Also, people with dementia may not be able to report abuse, and they may not be believed, even if they say somebody's hurting me. Now, we all know that sometimes confabulation or misrepresentation can go along with dementia, but my attitude is everybody gets believed until proven otherwise. We always have to look. So we don't want to go to the first thing of, well, they got Alzheimer's disease, so we can't believe anything they say. And the person might not be recognized as having a dementia, particularly in the early stages, and we'll talk about some of the consequences of that. Unfortunately, there's lots of different ways that an older adult with dementia, or any older adult, can be abused. Certainly financial exploitation is a very big one. I think we're all aware of sweetheart scams and other kinds of scams that even occur to people without dementia. Physical abuse, sexual assault, emotional abuse are really big, as is neglect. And we'll talk more about each of these in a moment. But we're really talking a lot now about polyvictimization the idea that a person with dementia is often abused in more than one way. So whenever we discover a particular type of abuse, we certainly want to inquire about other types as well. It looks like I just went backwards. Give me a moment here, everybody. All right. Abuse is definitely more common than most people realize. We estimate that about 1 in 10 older adults living in the community are abused or neglected. And I'll show you some data in a minute. We'll go through it pretty quickly, but just to prove to you that about 1 in 2 older adults living with dementia are going to be abused or neglected at some point during their course of illness. So it means that we really need to be on the lookout for this. We really don't know how common abuse and neglect are in nursing homes and assisted living. Like some of you out there who might be ombudsman, I'm a volunteer long-term care ombudsman, and we're always on the lookout for this when we're going into nursing homes. Now, in terms of abuse of people living with dementia, and this is just a quick reminder, I can't help it because I'm a physician, geriatrician, just a reminder that now we call MCI, mild cognitive disorder, minor neurocognitive disorder, and dementia is major neurocognitive disorder. You may all be familiar with it, but it still is terminology that's just been out in the past few years, so never hurts to remind. And the other really important thing I want to mention that I've learned from my colleagues who work in domestic violence is you don't want to blame the victim. So sometimes, you know, for me as a clinician, I'm seeing somebody with dementia who has a lot of what people would call problematic behaviors. And we're like, well, you know, I can understand why a caregiver would finally lose it. That may be true, but that doesn't make the abuse or the neglect okay. So I'm always having to remind myself, and I'll remind you, that it's good, I think, to understand where the caregiver is coming from, to even to empathize with where they're coming from, but not to blame the victim, and to make sure that we still provide appropriate intervention. Just a quickie of some work that we did quite a few years ago now, where we were just looking like, how common is this in people with dementia? So we were interviewing dyads, caregivers and people with dementia, and we interviewed 129 people. It was a very intensive study. And what we found is that about half of the people had experienced psychological abuse. And by this, I don't mean like, oh, sometimes they didn't talk very nice. I'm talking about severe stuff. In one case, a caregiver who started ripping the heads off dolls in front of her mother, and this was her mother's prized doll collection, with a very clear message being sent about, I don't like the way you're behaving. I mean, really frightening stuff. 10% we found physical abuse, and then neglect. What were some of the characteristics? Well, people with dementia who were more aggressive, like swearing at the caregiver, racial epithets, etc., or who were more physical, like pushing, shoving, resisting care, were more likely to be abused. And I just want to remind us that sometimes we're like, well, I guess that makes sense, you know, if somebody with dementia is yelling awful things at you, you're more likely to abuse them. Or if they're resisting care, you're more likely to hit them. But this was not a longitudinal study. We don't know which way the arrow goes. It's possible that these older adults with dementia were swearing or were resistant to care because they were being abused. So we just want to be, again, careful about assumptions. What were some of the caregiver characteristics? People with more anxiety, who had more symptoms of depression, socially isolated, people who really view this as a burden. And I'm sure this has happened with all of us. You know, you meet some family members who are caring for a loved one, and they say, you know, it is an honor to be caring for my mom. She just was wonderful, and I'm very happy to be doing this. And then you meet other people who say, you know what, I'm not too thrilled about this. She used to beat me up when I was a kid, and now here I am having to care for somebody. So we always want to understand where that person is coming from. Some of the conclusions from our study is that, again, about 1 in 2, about half of people with dementia will be mistreated, usually by a family member, and we have to screen. And it means we have to ask questions. And what I've learned is you can ask in a pretty straightforward way, because let's face it, most of these people who are doing the abusing, in my opinion and in my many years of experience, they're not bad people who you're trying to lock up. There are some people like that, truly, who are pathologic and where the criminal justice system is needed. but a lot of it are people who have just lost control for a variety of reasons. And so you can ask them. And so I ask quite directly, and we'll talk more about what I ask in just a moment. So you got to ask, and then depending on how they answer, you might want to ask a few more probing questions. So when I walk into a room, whether it's a house call or an exam room, I'm looking already at body language, how the dyad of the caregiver and the person with dementia are interacting. Are you seeing a caregiver who's got their arms crossed and tapping their feet and already seem kind of pissed off at that person by the time you walk in? Or are they, hanging out together and seem to be chatting? And then I ask pretty straightforward questions about how are things going? I know that sometimes your mom is a handful with some of these behaviors we've talked about. Have you ever gotten to a point where you hit her, or you're thinking about hitting her, or yelling at her? The other way I'll ask this question sometimes is just, are you ever ashamed of how you're behaving with your mom? Do you feel bad about how you're doing there? And providing some reassurance and normalizing it, but finding out, because really my goal really is to prevent abuse or to catch it at such an early stage. Nothing too horrible has happened yet. Just going to run through real quick. You all are familiar with the stages of Alzheimer's disease, and I will tell you, this is what I'm about to say in these next 3 slides is based on my anecdotal experience. I don't have research to back this up, but what I've observed is that people in the early stages of a dementia often are subjected to financial abuse. They're just confused enough to not know what's going on and be pretty vulnerable. As you get into more of the middle stages of Alzheimer's disease and other dementias where you're having more behavioral issues, people don't want to get dressed, they don't understand that they have a problem, they think you have a problem, etc. This is when I tend to see more physical abuse, hitting, shoving, and people really losing control physically. And then in the later stages, when you have a person with a dementia who now might be bedbound, unable to communicate well, this is when then we're more likely to see neglect. They're lying, and by this, again, this isn't little stuff. These are people lying in their own urine and feces, not for minutes or hours, but for many hours or days or even longer. So pretty bad stuff goes on in the area of neglect. So this is some of what we see in the arena of elder abuse and neglect. And I want to move on now to talk a little bit about how we deal with it, because it's so doggone complicated, at least I think it is. What you sometimes see is that there are all these intersecting medical, social, emotional, cognitive issues, and it can be hard to tell what the heck is going on. So we developed a model. This is where me being simple-minded comes in really handy. So we developed this model called the abuse intervention model. And I don't know about, I hope some of you can relate to this. If you've ever had a really messy desk with papers all over the place, and then you like find the papers that have something in common and put them in neat little stacks, and you just kind of feel better about it because it's all stacked up neatly, even though it's the same papers on the same desk. This is kind of what we did with the abuse intervention model. What are some neat stacks we can put risk factors into and figure out what to do? And the neat stacks that came up for us are, what are the characteristics of the older adult who's at risk for being abused? What are the characteristics of the trusted other or the caregiver? And then what are some of the risk factors or characteristics associated with the context of their situation? And what we then do is put all those things together, because oftentimes it's not just one thing that leads to elder mistreatment, but it's just the wrong combination of factors that might lead to abuse or neglect. So let me give you an example of somebody who has a dementing illness. And actually, I think I've just changed my mind, and rather than using this generic example, I'll tell you about a family I'm working with right now. The person who has a dementing illness is a woman who, she's on her second marriage, which has been a very long, good marriage. She has 2 children from her first marriage, and she is moderately demented, following her husband around quite a bit, asking, of course, repetitive questions, gets very anxious when she's out of his presence. He has a child from his first marriage where there is quite a bit of tension related to his adult child and the rest of the family. But now his adult child is helping him caregive for his wife. So we have now a number of different risk factors going on. We have this woman who has this greater dependency. She has this habit of following him around. Her anxiety is increasing. In his situation, I believe that he's depressed. And he's, I notice, getting more and more disengaged from wanting to care for her. So I'm getting pretty worried about that. And then the context is the person he relies on for social support is a child from his first marriage who doesn't really get along with his wife or with the other siblings. So lots of conflict is going to now start boiling up, and some of the relationship issues are going to boil up. There has not been any abuse yet. But so this is a family I really want to help and keep an eye on, and this is how we can use the model to identify a high-risk situation and also use the model to identify which of these pieces can we do something about. All right, I can't change the fact that she has moderately advanced Alzheimer's disease, but is there something I can do with her physical environment, with the family, that might ease some of the behaviors that she's having that are problematic for folks? Is there something I can do for the caregiver to help him gain some insight, maybe get his depression treated, work with some family conferences, family therapists to see if we can help people understand where each other is coming from? What can we do in terms of support related to daycare activities? So I hope you get what I'm saying here. It's really about what are the risk factors. Some of them we can't do anything about, some of them we can, and when we identify actual abuse going on, we use the same doggone model and look at the same doggone things and see what we can do to intervene and hopefully ameliorate the situation. We can't always make it go away completely, but we usually can make it at least a heck of a lot better. So what I'm really interested, is how do we move toward prevention, intervention, amelioration, treatment, and care? We just talked a little bit about prevention. Intervention, of course, we have to report to Adult Protective Services or the Ombudsman if they're living in a licensed facility, or even police. You got something really worrisome going on, you can call the police and get help. And APS is trying to do their best, and what they normally do is go in, try in a very calm way to assess the situation, make sure the person isn't in imminent danger, and then see what we can do to help the family, because our goal is to keep people together, even though we know there's a percentage of cases where people really need to be split apart. Unfortunately, for the person with dementia, too often it means we take them out of the house, which is not fair, right? So what we want to do is see what we can do to help everybody kind of lower the temperature of the water so it's not boiling anymore, and see what community supports might be available for folks and for individuals. And then the other thing I'll mention, because we often forget to do this, is treatment and care. Somebody who has been abused, they've been through a trauma. And so sometimes we okay, well, we've quote of fixed the situation or we've made it much less bad, but what kind of emotional support, in addition to physical, depending on what goes on, but often emotional support, does this person with dementia need in order to help them kind of get past, even though they might not remember the specifics, the feelings and the fear might still be present with them, and we really want to be sensitive to that. All right, well, let me just end by talking about a few of the resources that are available. We certainly hope you'll use our resources. We have at USC, we have a whole website full of training resources, so that if you wanted to learn more, or hey, if you want to give a presentation on elder abuse, these are resources that have been vetted. You can go and grab slides, manuals that tell you how to teach about it, video clips, etc. And please use it and teach the world about elder abuse. We also have a Center on Elder Mistreatment here at USC with a lot of articles and resources that we hope you'll find useful. And we're so proud that we also have the National Center on Elder Abuse in partnership with ACL housed here. And this is a very active site and a very active group. We have an incredible team. We send out, which we've proudly named our Elder Abuse Bites, B-Y-T-E-S, newsletter, which I'd encourage you to sign up for. We have a listserv. People use it all the time to give information or ask for help. We provide technical assistance, all kinds of training materials that you can actually download and make your own. So you can put your own logo on it. You'll see a website we have called STEAT, S-T-E-A-T. We've got fact sheets, educational materials, you name it, we got it. So I really hope that you'll look at our National Center on Elder Abuse website and use all of the materials that we have available for you and for folks in your community. So with that, I will end my presentation. It was just such a pleasure to talk to you. I put my email address down there in case anybody wants to reach me. Look forward to interacting with you during Q&A, and now turning it over to my friend and colleague, Charlie Sabatino.
Thank you, Laura. It's a special treat to be doing this program with you. And I, too, want to thank the National Alzheimer's Disease Resource Center and ACL for putting this together. It's an extremely important topic. My coverage today will include, we'll walk through these 5 topics in pretty summary fashion. You know, they really all apply to persons both living with dementia and those with no dementia, but of course dementia makes the risk and vulnerability skyrocket. The first topic is responses to elder abuse. This is pretty elementary. Obviously there's prevention, which may involve personal and legal planning and health planning, intervention, action steps when persons have experienced abuse and prevent further abuse, and remediation, which is intended to heal the harm or remedy the harm that has been done. I'm going to say a little bit about each of these. On the prevention side, I mean, everyone plays a role in prevention, from professionals, lawyers, healthcare professionals, neighbors, the public, social services professionals. Prevention may include advanced planning, which may involve legal documents, the careful selection of service providers, strategies to create oversight and accountability. And these don't necessarily need to involve complicated legal things. They may involve simple things like setting up third-party notifications on the person's utility bill. So if the bills aren't paid, a person is notified of that you've designated. The more eyes are always the better on a situation, especially if newcomers or strangers come in and commit abuse. But even trusted persons who have been around a long time, trusted family members, can turn out to be untrustworthy in the context that Laura has mentioned, when they're dealing with difficult family members, when they're subject to stress and financial stresses. The formula can result in abuse. On the intervention side, the steps that can be taken involve both criminal and civil, but they may include community responses from family and neighbors, social services interventions, multidisciplinary programs. Civil legal help may involve matters such as getting a restraining order or an injunction of some sort. And of course, people always think first of adult protective services and law enforcement when they think of elder abuse. And that's a very important resource. Adult protective services investigate and provide intervention services in elder abuse cases. They use state-specific definitions to determine if abuse can be substantiated, and one needs to know their state definitions. If their investigation substantiates abuse, this triggers the availability of many programs and services that might not otherwise be available, but with client consent. If client lacks the capacity to consent, there may be the opportunity to take certain protective actions all the way to the point of guardianship, although the trend in the law is to try to avoid guardianship when at all possible. It is the recourse of last resort. But even there are situations when a person's situation doesn't meet the state definitions of abuse or neglect, but not good things are still happening in those situations, and so abuse can be abuse even if it doesn't fit the definitions. And these are situations that are a little bit more ambiguous, but require a lot more creativity for people to figure out what to do. On the remediation side, this involves efforts to restore trust, dignity, autonomy, quality of life. What I should have put there first is financial stability, because that's often the first to be jeopardized. As Laura said, in early dementia, financial irregularities are kind of the first signs of that, which open up a vulnerability to abuse. And remediation may involve ongoing supports and services, restorative justice efforts, which are efforts to restore relationships, counseling, civil recovery of assets, and we'll talk more about that, restoration of rights that have been denied, for example, the ability to have visitation from whoever one wants, and it may require remediation and legal planning. The Elder Justice Toolkit that is mentioned here, I'll talk a little bit more about that towards the end. I have a slide on that. It's a great resource. Cultural sensitivity is an issue that penetrates the fabric of people's lives on all levels. And while behaviors may be a result of a person's dementia, they may also be infused with cultural explanations and forces that is very important to recognize. They may manifest themselves in resistance to accepting help. Certainly history of racism and discrimination affects people's willingness to accept help or cooperate. There are variations, cultural variations, what's normal behavior, family roles and authority, what risks are considered risks, perceptions of what it means to accept help, perceptions of your role. You may be seen as an outsider or as a government person or someone of a different caste. It doesn't require you to be an expert in particular cultures, but it does require us to have a non-judgmental attitude in learning what's important to a client's culture, what they value, what they fear in their culture. The cultural differences don't automatically justify certain behaviors, but they may help us understand them and respond to them. My second topic was adult protective services laws. The important thing to realize is there are 50 states plus territories, and there are 50 laws in those states and plus those in the territories, and they all differ somewhat in the way they define elder abuse and how they define who's eligible for services from APS. They differ in guidelines for reporting, both mandatory and permissive. And they describe some different frameworks for how adult protective services law enforcement step in and operate and resolve these cases. Even what we call this subject differs in state law. Some states call it elder abuse, some adult abuse, some vulnerable adult abuse. But it doesn't. You don't need to know how it's defined in every state. You just need to be aware in your state how it's defined and how it's operationalized. This is just a map representation of how of some of the differences, particularly in criteria for who is eligible for elder abuse. In some states, it's defined by age. In most states, it's all adults with a disability, but there are other variations such as just the elderly with disability or adults with disability, and then all elderly. So it does represent the mix of different laws that are out there. One difference is whether APS can investigate alleged abuse in residential facilities. And this, again, varies. In 38 states, APS investigates alleged abuse, neglect, and exploitation when they occur in at least some types of residential facilities, and those will be individually defined in a particular state. Maybe nursing homes, maybe assisted living, maybe licensed facilities, maybe unlicensed. In 14 states, APS never investigates allegations in facilities, and in a few states, 4 of them, the law was pretty ambiguous, and it may depend more on local custom and practice than on what the law states. Reporting requirements are quite varied. There's really, this slide says 1 of 2. I combined both in this one, so I should have scratched out that parenthetical that says 1 of 2. With universal reporting, mandatory reporting, everybody may be required to report suspicions of abuse, neglect, and exploitation in your state. Most states have a mandated list of reporters, and medical and law enforcement communities are by far the most frequent mandated reporters, but even healthcare professionals may be broken down into several subcategories that are detailed in the law, or the law may be very general about, say, medical and health professionals. Some states even have a combination of universal and mandatory reporting, but the bottom line is that anyone can report abuse and is encouraged to if they see it, and all states protect the confidentiality of the reporter to the extent possible. But you have to realize that may not always be possible given the circumstances. Now, the third topic I want to talk about is financial abuse and exploitation, because that's where the money is, and that's where the money goes down the drain. And as Laura said, this is often manifested as one of the earlier signs of dementia, poor judgment in financial decisions in particular. Financial exploitation, a simple definition, and again, this will vary from state to state, but a simple general definition is that it is illegal, unauthorized, or improper use of an older individual's resources by a caregiver or the person in a trusting relationship for the benefit of someone other than the older individual, usually the perpetrator's benefit. So I've mentioned financial exploitation. We often hear that there are cases of fraud or undue influence, and fraud involves an intentional lie or misstatement in order to bilk the person. Undue influence is the exertion of influence that changes their choice and impedes their free will. You might think of fraud as pulling the wool over the eyes of the individual, while undue influence is intentionally making their eyes see things differently than they would otherwise. But they are both financial abuse. Signs of financial exploitation are many. They may include any of these that are listed here: unmet needs, unpaid expenses, despite seemingly adequate income, missing financial statements or property, unusual banking activity, paying for goods or services that aren't provided, or unexplained purchases of gift cards. Those are always a giveaway. Wire transfers are always worrisome. Unusual deliveries of mail, unusual emails and phone calls and other communications. Persons suddenly expecting a windfall because they've been told they've made this unbelievable investment that'll, give them returns tenfold. Frequent or rapid turnover of investments or inappropriate investments, or the new friend or advisor who shows up in the person's life, followed by changes in behavior. Adding names to financial accounts, changing the agent on the power of attorney or the legal documents or documents missing, and the sudden or unexplained changes in estate plans. There are some, those are an example of signs that I took from the checklist that we did with the National Center on Law and Elder Rights, which is NCLR there. And I've included links to that, along with links to the Department of Justice Elder Justice Initiative that includes red flags, and the Consumer Financial Protection Bureau's making managing someone else's money, all really good resources. COVID-19, of course, has created a perfect storm for abuse, neglect, and exploitation in that it has created isolation for everyone, which has a much more damaging effect on older persons with disabilities, and particularly those with dementia. The economic downturn has created financial need of family members who may become abusers. And the financial situation may be a driving factor. And of course, the new government initiatives that help people give rise to all sorts of COVID-related scams, promising expedited economic benefits or low-cost quick testing or vaccine scams or charity scams, charities claiming to do wonderful things for COVID victims. So it has been a tough year on many levels in this field. The fourth topic I want to talk to you is about power of attorney abuse, and I've singled this out because powers of attorney have become kind of an every person's estate planning tool, and they are important for every person's planning for disability, but they carry risks that need to be understood and faced straight on because abuse can occur in a couple of points. One, in creating the power of attorney in the first place. The person may lack capacity in the first place to even execute the power of attorney, in that they've been somehow goaded to do it. There may be forgery or fraud in or misrepresentation in getting them to sign the document or undue influence. The other place that abuse can occur is in the implementation of the power of attorney. Transactions can exceed the intended authority. Perhaps the person does not have the authority to change beneficiaries on retirement accounts or insurance policies, but they go ahead and do it, and the third party didn't realize it, but they've exceeded their legal authority. Or transactions conducted for self-dealing. Perhaps the individual says, I'm going to buy Mom a new car. The old one is really broken down, and I buy the top-of-the-line BMW, which they're going to use 99% of the time, and it really wasn't for Mom or Dad. It was really for themselves. Or transactions contravening the principal's expectations. The agent may have the authority to sell real property, including the home, but the principal, when it was set up, was really intending them to preserve their real property and their home to the extent that that's all possible. So a lot of ways abuse can occur with powers of attorney. A few simple tips in preventing power of attorney abuse I mentioned here because these aren't required in any power of attorney laws in the state. So if you just pick up a form of some sort to do a power of attorney and fill it out, you may be missing all sorts of preventative strategies. And this is one of the reasons why I really believe in people being able to do many legal functions by self-help, but this is really an area. The power of attorney is a document that really needs good legal advice, because even attorneys who aren't well prepared in this area may not suggest needed prophylactic measures in the power of attorney, such as requiring an initial inventory, so you can tell whether a couple of years down the road things have changed and some things disappeared. Annual accountings to third persons, it might be to another family member, but to someone. It doesn't have to be a complicated amount of paperwork, but somebody else ought to know what's going on. Requiring second signatures for large transactions can help. Of course, the person can still do a million little transactions, but this helps prevent some major catastrophes happening that might otherwise. Granting the power to revoke a trusted third person. I had one case in my legal aid work in which the boarder for an older person became a trusted person, and it really helped take care of the house, and the individual wanted to grant that person a power of attorney. And we gave, with everyone's consent, the local social services agency the authority to revoke the power of attorney if they saw improper things happening. Certainly limiting the power to make gifts is really important. An open-ended gift authority is really a blank check and invites problems. There are a number of ways you can put limitations on gifts to who they go to and how much they can be. Hot powers are mentioned here, and when I use the term hot powers, they're really powers that one should think twice about giving to their agent, and either expressly say that they have this authority or don't, such as creating the right to change rights of survivorship on bank accounts and investment accounts, or to create or amend or revoke a trust document, delegating authority to someone else to do all the work. That doesn't mean you can't hire a professional. That means really turning over your authority to someone else. Or waiving the principal's rights under a joint and survivor annuity, the survivorship rights under retirement plans, or disclaiming property. This is when you suddenly get a legacy from someone else's estate. It may or may not be useful to accept it and rather to disclaim it. I mentioned managing someone else's money before. I mentioned it here again because it provides a good guide for agents under power of attorney, as well as under guardianship and trusts and representative payees. So I wanted you to be aware of that. It spells out the duties of all fiduciaries, which are acting in the person's best interest, managing the money properly and property carefully, keeping money and property separate from yours, and keeping good records. Fiduciary duties are pretty elementary and basic, although property can get complicated and decisions can get complicated. And finally, very quickly on civil remedies and prevention, there are a number of civil remedies in preventing continuing abuse, revoking a power of attorney or a contract. Sometimes divorce or legal separation is necessary if it is a spousal abuse situation. There are a variety of protective orders and restraining orders that can be considered, or injunctions that do require going to court. I mentioned guardianship, but as a last resort, guardianship is usually authority over the person, conservatorship over the property, although states may use different terminology. Civil actions for asset recovery, including a number of terms you may or may not be familiar with: seeking an accounting from someone who's been managing money, claiming a breach of fiduciary duties. Conversion is basically theft. Fraud or duress. Duress is another term for undue influence, and fraud can be both a civil and a criminal action. Rescission is claiming that a contract or agreement was never valid even in the first place. It's not that you're terminating it now, it's that it was never valid. Only a couple of states have a private right of action for elder abuse, which is great if the state, such as California, has that. Remedies can include restitution, which is having the property or money restored. Constructive trusts are a legal device for even when property has been transferred, it is still considered, the individual is still considered the equitable owner. And of course, damages can involve economic damages, non-economic damages such as pain and suffering, or even punitive damages. But, you know, while there are many civil remedies, they all have challenges. So the legal process can be slow and it delays. Evidence and witnesses may be unavailable. The victim may lack the capacity to testify. Proving the lack of capacity at some earlier point in time may be difficult. Proving undue influence is difficult also because it often happens behind closed doors. The victim may lack the resources to even have a lawyer. And the bottom line of all of this is even if you can do everything else, the perpetrators may have already spent the money and they may lack any money or resources for restitution. Criminal remedies have historically been underused, but in the last 10 years there's been an increasing recognition of abuse as a crime and increasing involvement of law enforcement and prosecutors. In fact, under the Elder Justice Prevention and Prosecution Act, the Department of Justice has trained at least one prosecutor in every judicial district in the country. How well they're trained, I'm not sure, but there has been training going on since that act. And courts and legislatures are trying to be more aggressive in addressing matters. So I'll end here with the Elder Justice Toolkit. It really includes almost really everything that I covered today, so it's worth taking a look at. You have the link there to it, and I will end with just also noting you can find help here. You can report to Elder Care Locator or the Elder Justice Initiative that the Department of Justice runs. Thank you. I'll stop there.
Great. Thank you so much, Charlie and Laura, for your fantastic presentations. Lots of really rich information. And our participants have been writing in some very insightful questions. So I'll start with the first one that's appearing on my screen, actually. What is the situation? What can you do if there is a person living with dementia who is acting in some kind of abusive manner? Is there any insight you can provide on what to do and how to approach that kind of situation? Laura, do you want to start with that one?
Yeah, I'm happy to. It's interesting in that this is a really common question, understandably, because people with dementia certainly can be abusive. But, you know, we're dealing with people who are impaired. And so I guess I just think about this in a very different way. This is, you know, sort of like blaming somebody who has diabetes for having blood sugar problems that they're trying to get under control. So when somebody with a dementing illness is behaving in a way that is abusive, we want to recognize it and then help people with it. But this is not where I'm calling Adult Protective Services, and you know, this is where I'm trying to help solve a situation. What I have found is it's very important for those of us who have whatever therapeutic interactions with families to privately ask a paid caregiver, because I've noticed that there are some paid caregivers who will put up with a lot because they don't want to lose their job or they really care about what they're doing. And so I ask caregivers, you know, are you being harmed in any way? Are you getting pinched or poked or hit or yelled at? And then I try and help settle the situation. But I also want the caregiver to understand that it's not personal, that this is part of the disease process. And I really, at that point, medicalize things, I think appropriately, to let people know like what the pathology is behind it and that this person can't do it. When I hear a caregiver saying, well, mom just won't do X, Y, or Z, that for me is a big red flag when I hear the won't piece, because oftentimes is they can't. They don't understand. They're confused. They're afraid. You know, they have a brain impairment. And so when families view this as something that this person really has control over when in fact they don't, I want to gently and lovingly help them understand that this isn't volitional, that this is something the person really can't do.
Thank you so much. Charlie, anything you want to add?
You know, this is a really timely topic because we have been involved with a research piece funded by the Retirement Research Foundation that has taken us into the criminal justice side of this for the first time, because these people, persons with dementia who act violently or inappropriately, find themselves entwined with the criminal justice system with increasing frequency. And we're finding that criminal justice professionals around the country are really troubled by not having the resources or the understanding to deal with these persons properly. So we have a project going on right now with several partners that are trying to get a basic framework for understanding the interaction between persons with dementia and the criminal justice system. That probably doesn't answer the personal question that was being asked, but it is, I mentioned it because it is becoming a much broader societal problem.
Great. Thank you so much for your responses. Let's move to another question here. Can you talk a little, and this really applies to both of you, about elder abuse implications when a family caregiver lives with someone with dementia, is providing appropriate care and support, but the caregiver has no income of their own and is relying on the person living with dementia's resources for their housing, food, etc. Do you want to start, Laura or Charlie?
Yeah. If it's okay with Charlie, I'll take a stab at it and then turn it over.
Go ahead.
This is where I use that model that we just talked about, the abuse intervention prevention model. Say, like, what are the risk factors in the person with dementia, the caregiver, and the context? And this is where context also becomes really important. Is this the relationship they've always had? So some people have had long-standing relationships where they, have lived together or always had planned to live together, and this is perfectly fine. Getting back to some of the cultural issues that Charlie mentioned earlier, this might be culturally appropriate as well. But if there's a lot of red flags, you've got family members saying something's wrong here, and by the way, that person who's living at home with mom is dealing drugs and just is grabbing her Social Security check. I mean, I've been on house calls where we have that kind of situation, we're concerned, and I have found an older adult being neglected in a back room who's demented and can't call for help, and that obviously is a very concerning situation where you want to have immediate intervention. But there are other contexts where this actually might be okay and appropriate. I'll turn over to Charlie to get his views.
Yeah, if this kind of situation, came to my attention, of course it depends upon the resources available, but we might want to consider a caregiver agreement that also explores, my role as an attorney is with older persons and families is usually to make sure they understand all the benefits and legal rights that they have. Many families don't take advantage of resources that may be out there from community services or social services. So evaluating that, making sure that if there are ways to enhance income or secure it, do that. Get very clear about what people's role is going to be, how far they can, how money can be used and how it's going to be managed. And doing something to get another set of eyes that periodically look into the situation. It's going to be unique to every situation, and sometimes if people don't want to take that kind of planning steps, it can be frustrating that you see it's going to go downhill and you can't do anything about it.
Yeah, and I'll just add one piece into that. This is Laura Mosqueda again, is that as a primary care doc, when I'm diagnosing somebody with dementia and I see this situation coming up where they're going to be living together, financial, et cetera, this is when I use some of the resources that Charlie mentioned, like managing someone else's money. Help people get educated about what their responsibilities are and expectations are when they're taking on this role.
Yeah,
great, thank you.
People are often willing to appreciate getting the training and information that they weren't aware of.
Definitely. Thank you both so much for that response. So something that comes up for many people, for those having older adults at home or people living with disabilities and people living with dementia, it's very hard for people to find caregivers. So I think that the question that's here from participant is, what kinds of questions can we ask? What are some things we can do to find caregivers who are, reputable and will provide the care that folks need without some of the issues that have been raised in this webinar? Any tips or tricks from both of you?
Well, I don't have them at my fingertips, but the disability communities through what we used to call independent living centers and have resources for training individuals to be their own boss over hiring and firing and training their caregivers. And there's some really good resources out there to do that. I'm sorry, I just don't have any at my fingertips because it is a difficult task, and there's no easy way to do it. You can go to agencies, but simply because you hire an agency doesn't mean your care is going to be perfect. It's also going to be likely more expensive. So the hiring individuals is often a more feasible choice for people. But you also have to think about other supports that may do little pieces of the puzzle. Even getting to know the mailman who can report any suspicious activities, somebody else who does regular business with the person, educating them of what to look for and help keep a lookout. So it may not be that you can find a caregiver who can be an all-purpose caregiver, but you can find support pieces in little patches around the community.
And I'll just add in briefly, don't be afraid to ask questions. And I don't know what the current state is. I really think there ought to be lists so that you know of people who have a history of abuse, but that is not easily available as I understand it. Background checks are of limited use. I think careful observation, you never know, what charming person you're bringing in who may be stealing or abusing or neglecting. So a high index of suspicion, or at least oversight in a friendly way, but really making sure, and when you see suspicious injuries, to bruises, fractures, falls, whatever, to have appropriate levels of concern.
Great, thank you so much. I think that we have run out of time in terms of questions. We'll need to wrap things up here, but I do want to thank you both again for your presentations today. We appreciate your participation and all the prep work that went into making today's webinar a reality, and one where we were able to provide some really excellent information to folks. So take a look at this last slide if you're interested in applying for funding through the Administration for Community Living for dementia-focused projects. You can find more information on grants.gov. And with that, I will thank you all for being here today at the National Alzheimer's and Dementia Resource Center webinar series. You can join us again on August 24th, where we'll talk about building and maintaining relationships after a dementia diagnosis. Registration information soon will be available on the ASA website. At this time, I will turn it back to Rob Lowe for some final remarks.
Thank you, Sari, and thank you, Laura, Charlie, and everyone at ACL and NADRC for today's excellent presentation. As a reminder, if you'd like to claim CEUs for today's webinar, you will be receiving a follow-up email that will contain a link to the CEU application. That follow-up email will also contain a link to today's slides. And also as a reminder, you have 60 days to claim CEUs for today's webinar, and ASA may take up to 30 days from the date of your submission in order for us to process and issue your CEUs. Again, thanks to everyone. Thanks for joining us today, and have a great day.